Yes. We'll
Give me a minute.
Okay.
Yeah. Chief complaints. Discharge from right ear since 20 years. Headache since 10 years. Irritable bowel syndrome since 5 years. She is on psychiatric treatment for depression since lockdown, that is since last year. Discharge from right ear since 20 years. Watery every day. Sometimes bloody or with pus. All started after my husband slapped me 20 years back. My hearing is also reduced. I took medicines, it didn't help. Then I underwent surgery. Discharge stopped. Again, 3 years back, my husband slapped. Discharge started. First bloody, then took antibiotics. Since then, not stopped either pus or blood or watery discharge. Surgery can't be done because already it is done once. Headache. She said it is a stress headache. Whenever I get stresses, fight with my husband, I will get it. Pain whole head. Pain as if my husband is sitting on my head. Dull aching pain. Nothing helps me. I will have lot of anger whenever I get headache. I shout and scream when I have headache. Nothing helps. 2 to 3 days I will have pain. Then gradually it comes down. My intestine is not good. I have to pass stools whenever I eat. I pass 8 to 10 times daily, usually with blood. Doctors did colonoscopy and they said it is irritable bowel syndrome and it is because of stress. When I take medicines, I am better. Some problem, that is stress. For her problem is always stress. I'll get back my problem. I am on psychiatric treatment. I developed depression once lockdown announced. I was very happy going to office. Not going out was like punishment given by my husband. I developed suicidal tendency. Wanted to ram my car to big trees. After medicines, she is on allopathic medicines. I am better. What must be reason for all your problems? That was my question. I asked her. Once she told, I allowed her to tell all her problems. Then I asked her, okay, what must be the reason? She said, Doctor, stress. My big problem is stress. All my problem starts because I have a stress. My husband is a big stress for me. I stay in UK. He thinks no relatives will come there and he can do whatever he wants. He can do. He doesn't want me to go to office. He made me pregnant thrice so that I can stay at home. He is very suspicious. He makes me angry all the time. He is so disorganized. What you do when you are angry? I want to slap him back. I want to break things. I don't do as things in US are very expensive. I tell him, what if I hit back or answer back you to the husband? Give respect and take respect. He is a dirty man. When we are arguing, he suddenly attacks me. It takes me some time to understand. He degrades my body parts, my hearing problems, because she has told me, no, I can't hear properly. Fears, I have a great fear of snakes. Even if I think of snake, I get palpitation and breathlessness. I don't like to see picture of snakes. Even snake pattern on clothes, leather items of snake like shoes and bags, I can't see. Even something comes in TV, I'll run away. If something of snake, comes in TV, she will run away. I have a phobia of closed places like MRI scans. I had attack inside when I went for MRI scan 2 years back. Dreams. I dream of my mother-in-law fighting with me always. Only in dreams I talk back. Otherwise, I don't talk back because my husband hits me. Dreams of black snakes. I feel suffocated in the sleep when I see snakes. I see ghosts. I speak to the ghost. I fight and argue with them. What else? I love small dogs. They are lot of love. I hate cats as they have an attitude. I am a peacock in the zoo. And my husband is poisonous toxic snake in the same zoo who needs to be kept in cage. Otherwise he attacks me, the lovely peacock. See the imagination where all patients go. If you allow them to talk, they take you to everywhere. Doctor, at the end she told me, Doctor, I forgot to tell you. I had too much of bleeding immediately after my second delivery. With great difficulty, it was stopped. Chalo, okay. Yeah. Can you see, Genova, my
Yeah,
PPTs?
yeah, I'm trying. I wait.
No, can you see my PPTs?
No, I wait. I switched on. I pushed some button and lost it. Ah, yes, it came. Yeah, now it's all right. Sorry.
No problem.
I
So,
enlarged your face because I wanted to see you bigger and then pushed some button and lost the
it
presentation.
is okay. I am reading what is there in the PPTs. So, it is okay if you cannot see the PPTs
Sorry,
also.
sorry.
So, with great difficulty, it stopped and I had lot of bleeding after second delivery. So, my analysis of this case is discharges, hemorrhagic tendencies, stress, reason for most of the complaints, husband and mother-in-law are enemies, wants to be out so that I am out of stress, angry, anxiety towards sudden attacks, fear and dreams of snakes, kingdom analysis, survival, competition, victim and aggressor, me versus husband lead to animal kingdom. Whatever complaint she is talking about, she comes to husband and his attacks. Someone is causing something. Me versus others. Husband or mother-in-law. Animal kingdom, victim and aggressor, split within self. Me versus others. Issue of survival. Reaction, I need to submit or overcome. Sensation, they did it to us, I will get them. When we talk kingdom analysis, in homeopathy practice so far, we have used symptoms as the only guide to the selection of remedy without really considering the source of the drug. To me, like to many classical homeopaths, the symptomology of any drug is intimately related to the source it is drawn from, and that each drug has it in the essence of the source. Our remedies, whether they come from plant, animal, or mineral sources, each represents the spirit of that source and must have the character of that source. I have attempted to identify and note down the main differentiating feature of the major kingdom from where our medicines are derived. So, after that animal kingdom, I have come to the sub kingdom, which is reptiles, come out again and gain warmth. They have a conflict in them between being seen to come out, being visible versus being hidden. Reptiles are very extremely careful of their surroundings. Careful, watchful, vigilant, and guarded. Two facets. One side is very nice, and other side is violent and destructive. Suddenness, sudden burst of activity from a position of absolute inactivity. Reptiles escape and hide, feeling of being at a disadvantage. Escapism is incompetence for face-to-face fight. Reptiles attack only when repeatedly provoked or cornered. Keywords: sudden, violence, bright colors, little or minimal parental care, swallowing things as a whole, need to be strong, tough, and aggressive. In reptiles, it is snakes. Snake's mode of attack is either poisoning or squeezing, and then swallowing the victim as a whole. Ability to survive without any limbs, crawling, swim, etc. Shedding or molting of the skin as a whole. Highly flexible jaw movements. The ability to swallow large objects almost twice of their size. Heightened sensitivity of a small smell and taste. In snakes, my choice is Crotaliny, constantly anticipating an unexpected covert attack. Therefore, need to be vigilant always on one hand and launching a sudden hidden assault on the opponents. Clarivians, they are more social than elapids. Melapids are not so social. My choice was Crotalus horridus, strong feeling as if someone is behind him or that he is surrounded by enemies, which in turn results in a preponderating and constant fearful state. It directs to this remedy. I had given her Crotalus horridus 200 two times 2 days. Within a week, discharge stopped. But she wanted medicine for her headache, IBS, and 6 months I gave. Then, once all those physical symptoms were better, she wanted for her discharge. Depression. So now she is completely out of allopathic drug for all her complaints. So this is a case.
Don't know how to zoom out. Thank you very much, Jyoti. It was a very beautiful case. You didn't say us more about
Welcome.
you. But okay, the next speaker. If you have any questions to Dr. Jyoti, you can ask. If not, the next speaker. It was very interesting case. Really. Someone is asking about repetition.
I had given once in 15 days, 2 times 2 days. Only 200. I did not go to 1M.
Okay, thank you. Brief understanding of other families of snakes, someone is asking, but we will have more snakes in next presentation, so Niharika and me will also talk about snakes. But Dr. Jyoti, you can give brief understanding of any other snakes. See, we will do some seminar only about snakes after that, because this is huge team. We cannot cover the whole team of snakes or mammals or whatever, but we will enlighten you of all these areas as much as we can. So Niharika, I have to make you co-host. Our next speaker is Niharika. She's a young student but very passionate in homeopathy, very good homeopath. She is also student of Dr. Shankaran, Goran Gekut. Wait. lost you, Niharika. I've just made you co-host, so now you can probably share presentation and your video. The remedy was Crotalus horridus. Because of this feeling of sudden dread is coming, because of blood was affected, the stomach and bleeding, the viperi, the arrow, their pathology is more connected with the blood disorganization instead of LAPD. They are more in LAPD, nervous system is more affected, but it depends on the particular snake. But in general, that is the major difference between both. So very glad to see you, Niharika. Thank you that you are here with us. I like to see your smile and enthusiasm. And looking forward to hear your lecture. Tell us.
Thank you very much, and I'm very grateful to be part of this program.
Tell us something about you, who you are.
Will I start?
Okay, you can start. Then you can tell about you.
So, good evening to all of you. I'm very grateful for this part of awesome event. Again, part 2. So, the first event in part 1 in Jungle, Water, Sky. This is the continuation of this part 1. So, here we again go. This is my discussion overview. What topic which I have to cover in this total discussion? Quick review of snake, proving in homeopathy, zoological characteristic in habitat, summaries of reptile, case of the old pioneers, theme of lattices, and doctrine of signatures, personality of lattices, and characteristic physical guiding symptoms. So these all points we have to will cover in upcoming during discussion in the 30 and 40 minutes. And first I want to give the gratitude for my gurus, especially Dr. Samuel Hahnemann, the father of homeopathy, respected Dr. Rajan Sankran sir and respected Dr. Gaurang Gaikwad sir. I am very thankful to both of person. They have to just taught me us lot of things. And first I want to start with like a last lecture quick review and recap. Whenever we have to seen any web series or any movie or any kind of serials, so we have to want 5 minutes quick review what we covered in the last lecture. So I want to tell you issues found in the animal cases. Mostly which issue found in the animal cases? So the first and foremost is the issue of survival.